I am representing the veterinary community, and in that role, the veterinary community could take a whole session just on describing what veterinarians do. You heard numerous veterinarians previously talk about their roles in industry, their roles in antimicrobial stewardship, and you can tell it's far-reaching and has a large effect both on the federal industry and private practice level. I thought I'd give you, we talk about telling the story, and I thought I'd give you just a brief history of myself to give you an idea of where the veterinary industries came from. I am a second-generation veterinarian, third if you count my great-grandfather who had a degree, mail-order degree from the University of Chicago and practiced on a buckboard in north-central Kansas. Growing up in my dad's veterinary practice, to give you an idea of how veterinary medicine's progressed, at one time there wasn't a lot of products that were available for veterinary medicine. I know, not to pick on Dr. Smith or Dr. Saltman, but they can remember times, and I remember times as a student in high school actually being a pharmacist in my dad's clinic, mixing up products that were going out, compounding products in the back as they went out to the producers in the area, because we didn't have a lot of options, didn't have a lot of tools. We're very fortunate now that as a profession we have a lot of valuable tools that pharmaceutical companies provide for us to use in the veterinary community. Speaking from a food animal standpoint, we don't want to lose those tools, and we find them essential for the care of our animals. And so that's one thing that we want to maintain, and part of our conversation is going to be around how we maintain those. I forgot to turn my timer on, so I'll probably run over. With that said, I wanted to follow up a little bit on what Dr. Saltman alluded to in his discussion on dosages, and the big gorilla in the room for the veterinary community has always been metrics, and I'll say it out loud. Metrics is the one that kind of scares us the most, and I think to understand why it scares us and not maybe as much on the human side is one example of the macrolide example that Dr. Saltman gave earlier, and I was going to carry that out a little bit further. If you take a typical animal that's treated at high risk of disease, and to your point, Arkansas having different risk factors, we as a veterinary community, speaking from the food animal side, can have different risk factors based on weather patterns. Drought-stricken feedstuffs or forages can have a drastic effect on cattle production when they come off grass. So there's a lot of factors that go into when we look at measuring use of antibiotics. And so those are all external factors. We look at just dosing, and we talk to, and I thank Roger for bringing that up, because I'm going to steal part of that thunder from you, Dr. Saltman, so I apologize for that, but I'll give you credit. If we look at 4 macrolides, macrolides being a shared class antibiotic, that we typically use for treatment of BRD, all being labeled for bovine respiratory disease, and you look at the dosage rates. And as you mentioned, one's 20 milligrams per kilogram, 2.5 milligrams per kilogram, and 4 milligrams per kilogram, and 6 milligrams per kilogram for each one of the individual products. If we take those products and multiply that by the size of the animal that's typically treated, a 250 kilogram calf that comes into that's been weaned, been trafficked through the production system, and is at high risk of disease, then you come up with a number, a multiple of that would be 5 grams, 625 milligrams, 1 gram, and 1.5 milligrams, respectively, for those products. Now, let's think back to Kevin Hazelwood and Cactus Feeders. Of the 1.3 million head they feed a year, and they have 10% of their cattle that go through for treatment, if we had one of those 4 products used, and we're looking at measuring use at that level on strictly a grams basis, then one product will have used 65,000 grams, one product will have used 8,100 grams, and this is rough numbers, one product would have used 13,000 grams, and one product will use 19,500 grams on those 13,000 animals they treated. So the big thing, the big heartburn that comes by when we start talking about metrics is the fact, how do we get to the right denominator? And from a veterinary standpoint, given that we could have a dog, a cat, a calf, another example would be a fluoroquinolone that we use for treatment. If we give an injection to a calf with a fluoroquinolone labeled for treatment, it's going to take about 50, I lost my number here, 50 milligrams of product, and if we treat a dog for the same condition, it's going to take, dogs will take 50 milligrams, and a calf's going to take 3,000 milligrams for the same condition. So when we look at that from a heartburn standpoint, a big thing we have from the veterinary community is that education. And to your point, doctor, not having that information, not understanding that, that's been a big part of the discussion. In the long run, we have approximately 66,000 practicing veterinarians in the United States. There's 105,000 veterinarians out there that are in industry or in federal government or some other role, whether it be marketing or leading organizations, however that may be. So we have a very small number, smaller than the number that is put into that actually perform production agriculture. If you think about that role, you saw the number 2% in production ag. Incidentally, another factoid from the bottom of the USA Today. Do you know how many people in the U.S. are incarcerated in prison in any one day? What percentage? 2.1%. More than are in production ag. Kind of odd.
Making a suggestion?
No, I think just a kind of novel. So that's one thing that you see. That's another number I saw in the USA Today one time. But in the long run, and to kind of go along the same lines, so we have a very small group of people that we're put in charge of, and they should be in charge of veterinary oversight in animal production. And so it's a role that veterinarians will take with great respect and dignity and challenge. And so that's one that from a leadership standpoint, we have a lot of education to do. Our typical education system is one that doesn't necessarily have to have everyone exposed to all facets of veterinary medicine, much like your cardiologist versus they get some exposure. But just like your cardiologist versus infectious disease person, there's a gap there in knowledge base. And so we face the same gap in veterinary medicine. And probably more so in that they don't get to see, you probably walk by a heart patient as you go look at someone sick. We don't necessarily walk by a dog to go look at a cow. So we have a challenge in the future on educating both within our profession and outside of our profession to the human health side. So those are all things that we look forward to attacking in the future. The key being, I wrote down a couple of other key issues. Jay Hill said it about getting his voice out as a producer. I'll close with kind of a concept. We saw that yesterday with the authenticity gap, if I can say that word, with our reputation and brand. I think part of the biggest issue that we have as veterinarians is that we have a great reputation as highly respected profession. What we don't have is one consistent brand. And so it's not that there's a gap, it's building that trust with defining what our brand is. And with that said, we have veterinarians that don't understand production medicine. They become the resource of the consumer when they go talk to them. And so we get misinformation out there. So I think we lose our authenticity gap as a veterinary profession. What we need to do is capture our brand so we can actually make that connection instead of having it diverge in that gap. So there's actually two moving targets in that.